Greetings and salutations, fine people. I'm Patti Alvarez. Welcome to The Good Soul, a show where we'll have supercharged chats with everyday humans from all walks of life and unpack what in their story will inspire us all. We'll extract the untapped wisdom, distill it, and serve it up to you in all the right ways that will engage, enlighten, and most of all, inspire growth within your soul. I think people are awesome. So join me on this journey through the hearts and minds of ordinary people to uncover the good soul within you. This is The Good Soul. Greetings and salutations, fine people. Welcome to The Good Soul. I can't believe here we are, episode 21. Today we are talking food, farming, and health. I also like to add in a term which I just learned, and I feel like this is the first time I've heard of this, is this term, and it's so eloquent, is culinary medicine. We are with my daughter, Molly Siciliano. Welcome to the show.
Thank you. Hello.
Hello. And we are also lucky enough to have consultant, author, and educator, Christina Badaracco. Welcome to the show, Christina.
Thank you so much for having me.
Thank you. Thank you so much for being here. So, I'm going to give you guys a little bit of history on what we're doing and why we're here. Molly and I were raised, we were kind of like a Thelma and Louise. If you look back on, I think it was like episode 5 that you were on, we talked a lot about your childhood. And a large part of Molly's childhood was my health and wellness, yoga,
Mm.
veganism, and we focused a lot on the way we spent our quality time, and our quality of life was very important. So I'm going to guess that that background had a little bit of an influence on what you're doing now.
Mhm.
So will you tell our viewers and listeners a little bit about where life landed you at this point?
Sure. So, yeah, definitely being raised by a former vegan, but vegan for
Yes.
the majority of my life, led me to become vegetarian eventually. And so I've always had a a big interest in nutrition and making sure that I was eating proper food, getting enough protein. I know all my doctors throughout my childhood were always like, "Is she getting enough protein?" Yes,
Of
yes.
course. Yes, the famous
um,
last words.
yeah, but yeah. So I've always had a big interest in it, and that's led me to where I am today. I love cooking. I was raised around food and you know,
Italian women who
Italian
love to
women
eat.
who love eating food. Yes, of course.
Yes.
So yeah, and I've just always been interested in nutrition.
Okay, so tell
Mhm.
me about where you are right now at Alabama.
Yeah, so right now I'm about to graduate with a degree in food and nutrition.
Mazel tov.
Yeah, and I am hoping to study naturopathic medicine in the future.
Awesome.
Yeah,
I'm hoping the same.
thanks.
And back to Christina,
Mhm,
what is our affiliation? And we are so lucky to have her here. So
mhm.
let's do her justice.
Right, yeah. So currently me and Christina, she is mentoring me through my internship. We're doing a lot of work with culinary medicine, which we will talk about later. But yeah, so thank you, Christina, for mentoring me through this whole process. I appreciate everything we have done so far. Yeah, so with that being said, Christina, tell us a little bit about yourself, what you do, what your life looks like.
Sure, happy to. So I am based in Washington, D.C., a little bit north of you all. I work in a variety of different areas related to nutrition. I am also a dietitian by training, although most of my work is not in clinical practice. I do consulting and education, and I also do a lot of writing. A big focus for me lately has been in the field of culinary medicine, teaching patients as well as healthcare providers about healthy cooking and integrating that into clinical care. I also am really interested in research and in space for how these types of interventions can improve health. I do a lot of work in the policy space, both healthcare policy and food policy. Um, I know we'll talk a little bit today about agriculture and farming. Some of my background is in food policy and the Farm Bill in particular. In the last few years, I've been really excited to have some different opportunities to educate healthcare professionals about agriculture policy, our Farm Bill in the United States, why it's important for health, why they should care, and what they can do about it to try to make a positive impact. I've also written and published cookbooks in the past, and had a variety of different types of projects, I'd say, in all different areas of nutrition. But I also always love working with students and mentees and interns, so have been excited to be able to work with you and for your enthusiasm in going into this field as well.
Yeah, well, great. I'm so happy to be working with you.
And
Um,
so is her mom.
yeah. So tell us a little bit about the field of culinary medicine. What does it look like? What does it look like in practice, even?
Absolutely. So I think the original definition from maybe about 20 years ago, as it was published, is that culinary medicine is the blending of the art of cooking with the science of food nutrition, and then even the practice of medicine. Another way of thinking about it is sort of an alternative way of delivering nutrition education, a more practical way. Think of it kind of comparable to when you and I take chemistry or biology in school. We also have a lab that helps to bring all the concepts that we're learning to life. We can see it happen before us. We can learn with our hands, with our eyes, with our ears. And that's what culinary medicine is. Except the extra fun part is that we can actually eat what we're making, unlike our biology and our chemistry labs, and enjoy the flavor and the community around it as well. A lot of interventions involving culinary medicine are with patients, often in group settings, like working together in a teaching kitchen, whether that's virtual or in person. A lot of the work in the field is also working with healthcare professionals, like I mentioned before, helping to enhance education for physicians, whom we know get so little nutrition education in school, as well as nursing students and even dietitians, because even though we may learn a lot about nutrition science, and you may have found this in some of your communities as well, Molly, as you've been studying, that not everybody who wants to become a dietitian really knows much, or even necessarily really enjoys cooking. So I think it's really important
Mm.
for those of us who are teaching people about nutrition that we have at least a basic understanding of how that translates into behavior and practice, for our patients.
Sure,
So
sure.
can I ask real quick? Speaking of, so if you're going to consult with somebody, the average person on the street, where would they go? How would they find somebody? And now we know we're definitely going to give your information out because she does work virtually, but how would the average person find somebody like you? And not necessarily somebody who's in health crisis, but just wants a better quality of life.
Absolutely. Well, first of all, I guess I'll say I'm a fairly non-traditional dietitian, based on the way I just described myself.
Mm.
But for people who want to find a dietitian, whether in your own area, in North Carolina, or elsewhere, there are a few different ways. One way, on the Academy of Nutrition and Dietetics website, there's sort of a database where you can search for a dietitian, and you can look by area of specialty, you can look by geographic area, some other parameters. For folks who are really focused on, or want to make sure that their insurance will cover the visit, they can actually contact their insurance company directly to ask, where's a dietitian who's in network who can help me? You might be able to ask a physician for a referral, although it's possible that the physician might not know, but you can always ask your physician for a referral. And word of mouth is another great way, asking your friends, asking your family, if they have someone they can recommend.
Perfect note to end on. So, guys, don't go away. Take some notes, get your notebook, and come back. We're going to have more coming up on The Good Soul. We're going to talk next about our healthcare system. Real exciting stuff. We'll see you on the flip side. Hey, everybody. Welcome back to The Good Soul. I'm Patti Alvarez, and we are on episode 21 talking food, farming, and health with my daughter, Molly Siciliano, and this wonderful consultant, author, educator in culinary medicine. And it sounds like a whole lot more than that, to be honest with you. But this is Christina Badaracco. Welcome back to segment two. And I just wanted to say on the end of segment one, we were talking about tapping into resources. And I just wanted to see, we talked more about, you talked a little bit about individuals. Also, I'm assuming hospitals, libraries, education centers, there's other areas where people like you go and educate the public on what we're talking about.
Yes, absolutely, and that's a good point too. What I was suggesting was a way to find a dietitian who might be able to meet with people one on one for individual counseling. And
Sure, sure.
I do think that is really important to get sort of personalized care. But you're right that there are many other ways to get good nutrition education and even more sort of culinary education. And I like that you mentioned libraries. I'm familiar with an example in Philadelphia. I'm not sure down in North Carolina, but there is actually a teaching kitchen at the Free Library of Philadelphia where they teach healthy cooking classes to anyone. Even they have a class where they're teaching English as a second language through culinary medicine, which is so cool.
Wow. Yeah.
There are also grocery stores. I know several major grocery chains around the country they even have dietitians on staff who can teach healthy cooking classes, and they're often free to the community. Certainly hospitals, like you mentioned, a lot of big hospital systems. Sometimes the kitchen might be at the hospital, sometimes it's in an outpatient clinic. Um, so there are a lot of different settings around the community where people can look for some of this good hands-on education as well.
Sure. So, on that note, this is important. And I think that in this day and age, with YouTube and Reels and this and that, and people like Oprah, we learn and we have learned, and we all can pretty much establish that there's such a direct correlation between the food we eat and our quality of life and our health. But from your perspective, from a professional's perspective, can you speak on that a little bit?
Sure, absolutely. I do agree. I think that most people at this point in time do at least know that the food that we eat, is closely tied to our health. Having that knowledge does not necessarily translate to behavior change for
Sure.
many
We don't
reasons.
we don't we don't always adhere to that, Christine.
Some of that is due to individual factors and preferences. Some of it is also environmental factors based on what people have access to and transportation and so forth. But yeah, well, there are absolutely so many links between the food that we're eating and our health outcomes. I think we've known for many years about the link between many different chronic diseases and the way certain types of foods or excess of certain types of foods and deficiencies in other types of foods might lead to inflammation, lead to elevated blood sugar, and then lead to chronic diseases, whether they may be diabetes, heart disease, etc. I think in the last maybe 4-ish years with the COVID pandemic, there's also been a lot more attention among the general public into the connection between our immune system and our resiliency against infectious diseases and nutrition. Um, I know we'll talk a little bit more about like agriculture as well and food production, but I
Mhm.
think we continue to see among the public more and more interest in the way their food is produced and wanting more transparency in the food system. So when we think about like antibiotics and hormones and pesticides and all of those things that are used in the way our food is produced, well, those chemicals and other inputs also affect our health. And there's absolutely a very robust and growing evidence base to talk about the importance of all of those drivers.
Sure. I had just read something, it was a book called The Rainwater or Rain Barrel Effect. I don't know if you've ever heard of that.
Hmm.
But it's hormone based, and I had a hormone specialist on a few episodes back,
Hmm.
but talking so much about, I mean, as I'm sure you know this all too well, deodorants, our lotions,
Hmm.
I mean, our cleansers, the things that we use around our house. I know this is a little off topic because we are talking about the healthcare system, but I'm sure that's something too that you have to integrate into your teachings.
It is, and you're right that I'd say in my profession, I'm typically more focused on some of those exposures through our food, but
Yeah.
I personally do really care about some of the personal care products and cleaning products like you're talking about. And even if it's not part of my work, I always share that information with friends and family, and people actually come to me for that information. So I do see it as related to my area of expertise. I also have background in public health, and so I am very interested in some of those environmental exposures as well.
Yeah. So let's talk hospitals and doctors and tying this all in together.
Yeah. So obviously, food is a huge part of our health. So what do you see as the importance of dietitians in our healthcare system overall? And how do dietitians really interact with physicians, and what is the correlation there?
Yeah, so dietitians are the key group of healthcare providers in our country who have specific expertise in nutrition. There are many other types of healthcare providers, whether they be nurses, PAs, physician assistants, physicians, whatever, who may have degrees in nutrition or have advanced study or do research or focus their practice. But dietitians are the specific group who have that area of expertise. And we work in a lot of different capacities. I explained to you before how I have worked in a variety of capacities in the past. And Molly, I'm sure you're even learning through your courses and networking with other dietitians that there are so many different areas where they work. I'd say the most traditional path is to work clinically, whether that be in a hospital, working in an inpatient setting, like putting people on maybe tube feeds or IV feeds if they're not able to eat orally. Maybe working in an outpatient clinic supporting maybe weight loss or people with gastrointestinal diseases, or a pediatric clinic, something like that. There are dietitians also who work in private practice. So when I was talking before about how people can go about finding a dietitian in their community that they might want to work with. Some dietitians have their own independent practice, and I can actually, I'm licensed here in the district and in some other states, so I can see, without being part of a healthcare institution, I can see patients individually. Dietitians also have a prominent role in our healthcare system and working in food service. So designing menus for patients. Uh, some dietitians, I'd say, are also really focused on sort of procurement and thinking about buying more local food, which I think is very exciting, to really support sustainable procurement of food in our healthcare system. So I think they play such an important role in multidisciplinary teams of healthcare providers to treat disease, but also thinking more upstream to prevent disease, thinking outside of the hospital, maybe those working in private practice. If there are people who want to, members of the public who want to learn more about being healthy and preventing disease, I think dietitians can be key players in helping to do that, help to prevent development of disease, keep them out of the hospital. And so we can add so much value, even if it's not always measured, although as I mentioned before, I do really care about research. So I certainly hope a lot of dietitians are, collecting data and showing what a positive impact we can make, to articulate our value. I mentioned a second ago the idea of multidisciplinary teams. So I think ideally, dietitians are working on teams alongside with physicians and nurses and other types of healthcare providers to make sure that patients' comprehensive needs are being met. Information is being shared, and certainly that patients are always part of the decision making as well. Um, I'd say at this point in time in our country, dietitians are not always part of that group, and there are a lot of potential barriers that may get in the way. One might be back to that, lack of nutrition education among some of our physicians that I mentioned before. Insurance coverage for patients to meet with dietitians is often a barrier, so they may not even always have the opportunity to connect with patients. Um, and so there are several other barriers that might get in the way, but I'd say sort of that ideal situation would be that a dietitian would be a part of the care team for any patient seeking to either prevent disease or help to optimize management of a disease.
Yeah, I was wondering because I think I'm a 52-year-old woman. I've had a couple minor surgeries, but in and out of the hospital, no more than your average person. My parents, sadly, we lost to cancer. And I just think back on my
Mm.
life, and I at no point remember having the luxury of having somebody like you presented to me. I've handed a menu when I walk in the hospital, and I get to check off what I want to eat, but nobody is sitting down and saying to me, "Well, Patty, you have this, so maybe eating that would help." I mean, that's how, take me through that kind of that food chain, no pun intended. How do you find the doctors and then make way to the patients, not only in crisis, but people who just, again, are being referred to? Do the doctors refer you? How does that work?
Sure. The situation would look very different in a hospital setting versus outside of the hospital. But you kind of mentioned in the hospital. Um, Most hospitals, certainly the largest hospitals, are going to have entire staff an entire staff of dietitians in their hospital. Now, I would may argue that the staff is too small. They don't have enough dietitians on staff, but there will be dietitians there. And so, very often they do rely on a referral from that patient's physician to, be able to go to that patient's room and provide an assessment. And if the patient is coherent and able to meet to have a conversation with the patient, provide some of that individual information, like you said. But sometimes, even without a physician referral, dietitians know on certain floors, like especially some surgical floors, like you mentioned, there are just even greater risk for patients of nutrition deficiencies. Maybe they're going too long without eating. There are multiple days without any nourishment. So
Sure.
sometimes dietitians will just keep an eye on records and sort of flag and go visit the patient of their own accord. But the best way is to make sure that the physicians are providing those referrals for the dietitians.
Perfect. On that note, we're going to wrap up segment two. There's so much to be shared. It's hard to stop. But guys, don't go away. We'll see you in just three shakes of a lamb's tail. And in our third segment, we're going to be talking about sustainable food and agriculture. I'm excited. So we'll see you for segment three on The Good Soul. Welcome back, everybody, to The Good Soul. I'm Patti Alvarez, and we are talking food, farming, and health. We're on episode 21, and we are here with my daughter, Molly Siciliano, and her trusted, I don't even know what the word would be, internship mentor, Christina Badaracco. Christina is I want to get this right, a consultant, author, and educator in the art, I would say, because it is an art of culinary medicine. So one of the most exciting things about you, Christina, when I was learning about you in the beginning was your affiliation with the Farm Bill and your contribution to the Farm Bill. I think that is, and I started doing a little bit of learning, but there's no way that I can do any form of justice to what you do other than I love so much our country and our government, and I love getting to meet with people who are serving us. And this is just yet another way that we can serve one another. So tell us about the Farm Bill, how you got involved, and what it means for all of us.
Sure. So, first, I guess what the Farm Bill is, and then I'll mention how I got involved. So, it is our country's really largest piece of agricultural legislation that has been around for, I guess, about 90 years. Our first Farm Bill was signed into law back in the 30s. We reauthorize it every 5 to 7 years, and it's a massive package of programs that fund all sorts of different initiatives related to agriculture in this country. So, I guess the four largest sort of categories of programs involve crop insurance subsidies, commodity subsidies, nutrition assistance programs, and then conservation programs. The nutrition assistance program sort of bucket, that's by far the largest in our farm bill, and the proportion kind of keeps increasing each year. Um, and there are several other types of programs there as well. And I think I mentioned before, we reauthorize this farm bill roughly every 5 to 7 years, and this currently 2024 is a farm bill reauthorization year. So for anybody who's reading the news, following along, you may know that the agriculture committees in each the Senate and the House of Representatives in the U.S. Congress are very busy working on their drafts of the Farm Bill. For the real policy wonks out there, you may know that House Ag Committee put out their draft bill just a couple weeks ago, and I think we're anticipating the Senate's version this week.
So,
And
could I just ask you a quick question? Is it basically almost like a revised version of the one back from the 30s that you have to kind of comb through and analyze and say, we like this, we don't like this?
yeah, a revision or sort of, I guess, a new addition maybe is another way to think about it.
Okay.
There's
Modernizing it?
modernizing. There are changes, I'd say, made every time. Some reauthorizations you'll see bigger changes than others. I think we'll probably talk a little bit more about implications. I think a lot of us would love to see major changes, major revisions, if not even a redesigned farm bill. But yes, there will be definitely the revisions and the updates made each time.
Okay.
And then, if your other question was about how I got involved, so I'm happy to speak just briefly about that. It was
Mhm.
actually while I was in graduate school. I was out at UC Berkeley, and through a center we have on campus called the Berkeley Food Institute, I was connected with my now co-author, Dan Imhoff, who had written a lot about sustainable agriculture in the past, and he was looking for somebody to work with him on his next edition of this book about the Farm Bill. And I was very eager to apply and contact him based on my interest in sustainable agriculture, also my interest in writing. And so we embarked on a couple year effort to do all of the research. And then the book was published 2019, just I guess a little over a month after our last farm bill was signed into law. And since that time, we've had opportunities to teach all sorts of different audiences, sometimes at universities, sometimes at conferences, all sorts of different venues to teach different groups of people about what the farm bill is, why it matters, how it affects health and the environment, the economy. And then if people are concerned when they hear what we have to tell them, we want to offer recommendations. Well, what can you do about it as a consumer, as a taxpayer, as a whatever constituent, group you may represent?
Can I ask a silly question? I'm sure both of you can answer this. Can you tell me what sustainable agriculture means?
Sure. So I might start by saying I guess the word sustainable sometimes may be a little bit overused. Some groups may kind of take it and use it in sort of their own way. But to me, I would say it refers to a way of producing food that is good for people and good for the planet and helps to protect the quality of the soil and the air and the water, and even wildlife so that we can continue to grow food and nourish people, in the US and around the world. So that's sort of a
Okay.
simple way of putting it.
All right. Cool. Molly, what do you need to know? Come on.
So a big question that I have is like, obviously there's policy changes that are being made. I don't know if this necessarily relates to the average person, but why would the farm bill be important to the average person? Someone who isn't a farmer, someone who just they work at a bank, for example. Like how does it impact their lives?
Yeah, I think that's so important to understand. And I guess a first way to answer that question is, well, we are all taxpayers. And so every penny that our federal government spends, well, that comes from our tax dollars. So all these programs, the billions and billions of dollars every year, this is our money. And we want to make sure that it's being used responsibly to help people and help our country and help our planet.
And
Uh,
I just have to add, I think I saw it's a $92 billion budget, the farm bill. Is that correct?
Well, I guess each farm bill will have a different price tag,
Okay.
so it's
Yeah.
going to vary. But
Megabucks though.
yeah, enormous amounts of money.
Yes. Yes.
And so I mentioned before that two of those top four categories of programs go primarily to commodity crops, the crop insurance subsidies, and then the commodity subsidies. And when I use the word commodity, think of crops like corn and soy and wheat and sorghum and canola. These crops, well, a lot of what is produced actually don't even end up in our food supply. They may end up in ethanol to run our cars or other things like that. But if they do end up in our food supply, they're typically in ultra processed foods, which we know are not very healthy. In fact, Molly, I know you and I were just looking at a slide about ultra processed foods yesterday. Um, or So we are, through our subsidy dollars, primarily helping to support, at this point, really the biggest farms in the US that are producing these commodity crops, that are producing food that is not really even nourishing for us. And it's not nourishing for the planet because there's also a lot of application of chemicals. Again, think of things like pesticides and herbicides and others that are used on these crops, synthetic fertilizers. And in stark contrast, there's very little funding through the Farm Bill that is supporting production of what USDA calls specialty crops, which are the fruits and the vegetables and the nuts and a lot of the types of foods that I think you and I and anybody listening to this call probably know should be filling most of the space on our plate. So there's really a major discrepancy in the way money is spent through the Farm Bill and the type of agricultural system that it's boosting up. And then on the other hand, the way we know that we really should be growing food and eating food to promote health. To tie back to the healthcare discussion we had a minute ago, I also find it pretty upsetting that we're producing more of these foods and producing a food system that are fueling poor health and causing us to spend more on healthcare as a result. And so I think we have a real discrepancy in our country between our healthcare system and our food system, that I think we really need to do a better job at integrating to make positive impacts in both.
Christina, real quick, is it just foodstuffs or is it also like cotton for the clothing we use and so forth with regards to the farm bill?
Yes, so commodity is another one of those top commodities. So
Mhm.
yes, there will be some
Cotton.
fibers there as well.
Gotcha. All right, good. All right, so listen, this is perfect because our last segment is going to talk about application in life. And I'm really excited to get into this as it relates not only to the Farm Bill, but also to the magnificent work you do. So, guys, last segment going to be the best segment. Don't go away. We'll see you in just a few on the Good Soul.
Hi, everyone. Welcome back to The Good Soul. I'm Molly Siciliano, and this is my wonderful mother, Patricia Alvarez. And we are joined by Christina Badaracco. So leading back to our last segment that we talked about, mostly food, farming, and health. How can we support sustainable production and sustainable eating in our everyday lives? I know you talked about the specialty crops, which aren't necessarily specialty to us, but yeah, how do we support farming in that regard?
So I definitely think that um, most accessible or most immediate recommendation is be conscious consumers and think about the foods that you're buying at home and where those foods are coming from. To whatever extent people can trying to buy foods that are grown in your region. And farmers markets or CSAs can be a great way to do that. But sometimes your local grocery stores may be able to help connect you with food from your region. I'm sure there's a lot of wonderful food being grown in North Carolina and the surrounding states. And so thinking about the food that we're buying, bringing into our home. Some people on the line may work in the food industry, in food service. So I think trying to think about also buying locally, buying healthier foods and making those available. I do think education is a wonderful impact that people can make. And that doesn't have to be formal education. That can be educating your children, thinking about like you two started off this show talking about the way Molly was raised, making sure children grow up seeing and trying, exploring healthier foods and understanding why they're important. So we always want to be passing that along to the next generation, even just talking with our neighbors, talking with our friends, who may not have really thought about healthier and more sustainable food yet. So bringing these up in conversation. um, I'm sure people listening to this work in all sorts of different sectors. Not everybody may focus in food and nutrition in their careers, but for those who may dabble in this area, other positive ways to make impact might involve writing op-eds, writing commentaries, gosh, I don't know, speaking in a podcast or giving interviews, giving guest lectures, again, bringing up these topics in conversation so more people are aware, knowing why these issues or how these issues have come to be and what we can do about them. We one other way when we think about sort of the policy realm, how we can make a positive impact. Another way is to actually directly contact your members of Congress, whether that's in the Senate or the House of Representatives, especially if they're on an agriculture committee. So you can look online and find out if your representatives and senators are on an ag committee, and then you can call them. You can also write to them and let them know, either if you're concerned about maybe a way that they voted or what is in the current draft of the Farm Bill. Or maybe you want to thank them for their support of
Mm,
maybe a great program or a great bill that you think is promoting a healthier and more sustainable food system. Do
sure.
keep in mind too that there's also policy on the state level and even locally. So there may be policies and programs that are being offered at the state level. Similarly, you can get in touch with your state senators and your state representatives in the same way and make a positive impact as a constituent.
Christina, where does SNAP fit into all of this? Because that seems to me like the most that speaks to the people versus the industry.
So, and I didn't really dig in too much before. When I mentioned those four biggest categories of programs in the Farm Bill, the biggest by far is nutrition assistance. And SNAP stands for Supplemental Nutrition Assistance Program. It was formerly known as food stamps in the United States. It's been around.
Oh, okay. I did
So
not know
it's
that.
our largest nutrition assistance program by far in the country. And so at this point, we administer benefits through it's essentially a debit card. It's called EBT, Electronic Benefits Transfer, and it's money, a certain amount of money that people receive, people who are eligible and participate in the program. They receive to buy food. They receive a certain amount of money every month, and they can go buy food. I'd say traditionally it was mostly at grocery stores, also, even things like corner stores, et cetera, but increasingly more farmers markets and more sort of alternative ways of buying groceries are able to accept SNAP benefits and sometimes even offering incentives for purchases of produce or other healthy foods.
Are they regulated? In other words, no Marlboro Lights and gin and juice on on the SNAP card, correct? Is it?
So somewhat. So the examples you just gave are not eligible. That's right. They cannot be used.
Thank God.
But there are not really regulations in terms of the nutritional quality of food. So,
Mm,
for example, buying, French fries or candy or soda, we actually know that soda is one of the top purchased foods with SNAP benefits. So we don't really have regulation based on foods that are considered healthy. In contrast, there are some other nutrition assistance programs in the country. This is outside of the Farm Bill, but some of your listeners may have heard of WIC. It's our largest
sure.
nutrition assistance for women, infants, and children. And that is a very specific package of food that has been designed to meet specific nutrition needs for the women before and after pregnancy and then children. But in terms of SNAP, it's really pretty broad. And different people have different perspectives about whether we should regulate, restrict to a greater extent so that we know those dollars are being spent only on healthy foods.
Well, I think a lot of it, obviously, our eating habits are culturally influenced, and it's really difficult to sometimes interfere with that. I mean, it's in the fabric of who we are. But I would guess that a part of the SNAP and programs like WIC involves educating the beneficiaries to some degree. Is that true or no?
It is absolutely yes. In terms of WIC, and I've worked in the WIC setting in the past. So there are WIC clinics where people, the women and with their children, they go and they do receive education. They do receive some one-on-one education. It's not a lot. It's typically like a 15-minute or fairly short appointment, but they do get some individual education on things like healthy weight trajectories, and very often juice is something that comes up in our education, and lead and iron and sort of other micronutrients. But there are also group programs that might be available for groups of women and their children through WIC. And then SNAP also has a component called SNAP Ed or SNAP Education.
Okay.
And so there are different ways to administer education through SNAP Ed as well. But I certainly say, like you said, there's so many cultural and personal other preferences and behaviors that people have that that the education can only go so far as well.
Sure. Sure. And these programs, WIC and SNAP, obviously we know SNAP is federal, but WIC, is that also federally funded or is that state?
It's federally funded, just not through the Farm Bill. It's through the Child Nutrition Reauthorization, so it's sort of over closer to school lunch program,
Okay.
but administered through USDA or Department of Agriculture.
Right. Do you have a question brewing within you? You look like you're
I
bubbling.
do. I do. I have a
Sing
question
away.
brewing. So, if someone, for example, who's listening, does not receive SNAP or WIC benefits, maybe they have learned through the grapevine about the food pyramid or my plate, or maybe they haven't. Um, Basically, nutrition is so complex and it is always changing. I know that the food pyramid isn't necessarily in use anymore. So how can listeners implement nutrition practices into their everyday lives, depending on whether they do or don't use Wick and Snap? So what can average people do to become healthier?
That's a massive, massive
Mhm.
Yeah, I know it's a lot.
You got about 12 hours?
it's important. And I think just sort of the first step in terms of improving nutrition, improving health is that sort of readiness to change, being open to, learning information and thinking, how does this fit into my lifestyle? So, I mean, for people who are either eligible for or receiving WIC and SNAP benefits, I think certainly using those benefits and utilizing the education and that can be very helpful in terms of improving their food nutrition security, improving their health, and improving health for their families. But outside of that, I mean, we certainly know that Americans who are not on one of these assistance programs, we're not really buying very healthy food. We're not eating very healthy food, and we don't have great health either. So, just having the means to buy healthier food, having the resources does not necessarily mean we do it. So, early on in the call today, we talked a little bit about different ways to find dietitians, find nutrition education in your community, which I do think are great ways to do this. So, some Americans do have cooking skills, but not everyone does. And so, looking maybe for a teaching kitchen in your community, whether it's at a YMCA or through a healthcare organization, through a grocery store, through a library, so you can learn some basic nutrition education, learn some basic culinary skills in a setting that is comfortable, approachable. You may make friends and be able to try new foods, try new methods that you might not necessarily be comfortable trying at home.
Hey,
Yeah.
wait. Also, we're going to be having a workshop
Yeah.
on July 9th, so maybe we can find a way to record it and gear it towards not just the people who attend it physically, but also kind of gear it towards the masses. That might be helpful.
Yes, and that's a great plug, and I know
Yes,
Molly's really excited to get to lead that as well.
I am too. No, I'm
Yeah.
excited to have it. That's
Uh,
fantastic.
Absolutely. So, yeah, I think, looking for more evidence-based information. You mentioned earlier about like social media and the different ways that people
Mm,
are confronted with a lot of misinformation about nutrition. So, looking to, health professionals, peer-reviewed evidence, looking to healthcare organizations that are publishing information and not just relying on social media. Because remember, anybody can say anything on social media, whether or not it's true.
And
Uh,
then in the words of the great Abe Lincoln, just because you read it on the internet doesn't mean it's true.
right.
I
Absolutely.
love that line. Christina, I hate to do this, but it's time. I mean, it flew by so quickly. I can't believe it. So I just want to get in a couple of plugs for you because I think that this lovely human being has a wealth of knowledge that really a lot of us can benefit from. So first you start with her website, which is ChristinaBadaracco.com. We're going to put it in the show description, and also you can find it on our website. Cookbooks are free. I'm assuming there's links to your cookbooks on the website.
Yes, yes.
Okay. The Farm Bill book, which she wrote, same thing. You can find links to that on your website. Is there anything I'm missing?
I think that does it for today. I mean, if listeners are interested in more information, they can certainly find links to articles and other things that I've written on my website. If they do have follow-up questions or interested in either, personalized nutrition counseling and education, I'm happy to talk with folks. Or if, anything we talked about today just sparks questions and they're looking for more information,
Okay.
they're welcome to reach out and they can find me through my website.
Also, maybe I see a part two in our future. Who knows? So we could talk about that after the workshop. But guys, thank you so much for tuning in. Thank you to my beautiful baby Molly for facilitating this. Christina, again, thank you so much. And we'll catch up for that podcast, for that workshop. I'll give you guys more information and we will see you next time on The Good Soul. Most of all, thank you guys for tuning in. We love you all.